Good morning, Mr. Smith. Come in,
Uh,
please.
yes, good morning, doctor.
How can I, nice to meet you. Nice to see you again. How can I help you?
Well, doctor, it's about my son Joshua.
Oh,
Joshua has had diarrhea. I think it is gastroenteritis.
oh,
Um, it started yesterday morning, and yeah, in the since yesterday he's passed about 8 to 10 times,
uh-huh.
and I'm really worried. I think he's getting dehydrated.
Oh, is okay. I'm sorry to hear that. It must be a stressful time. Can I ask more some question?
Some more questions, okay? Uh, yeah,
Some
okay.
more question.
Yeah, okay, sure. Go ahead, please.
Um, um, is it the Joshua's the bowel movement is malodor? Is bad smelling?
Oh, it's not smelly. But yeah, just normal smell. But yeah,
Oh,
it was just too many times. It was 8 to 10 times.
and there was any blood in his bowel movement or not?
No, no, there was no blood. Oh, by the way, he had he vomited twice this morning, and after
Uh,
feeds, yes. Uh,
okay.
I just remembered that.
Immediately after feeding,
Yes, yes, it was this morning.
and in the large scale or is a little amount?
Not just whatever he had. So
Okay, okay, I know that. And maybe you feel that Joshua was born during this, maybe
Uh,
has fever or not?
yes, yes, he had some fever now that you're asking, and he did have some cough as well last night. Yes.
Okay, and does he drinks or eating as usual?
Yes. He's just breastfed. It's
Just breastfeed, yeah.
yes.
And as normal, the breastfeeding, the amount of as normal.
I think so. Yeah, we wouldn't know because yeah, he starts eating and then he passes the stools and yeah, maybe.
The water urine, the volume of water urine as normal.
I think so. I think he had a couple of wet nappies
Okay,
without poo. Yes.
okay. Um, So, as you said that Joshua has had a diarrhea from yesterday around 8 to 10 times in this period, and additionally, after breastfeeding, he had 2 times vomiting and a little bit fever and a cough from yesterday. Is it all right?
Yes, that's true. That's correct, doctor.
No, you are worried about that. Maybe he has dehydration, or maybe he needs some drugs for his condition. Is it all right?
Yes, that's correct. Yes.
Yes, okay. I would say that Joshua has something called infections in his gut, and the cause of this is sometimes bacterial, sometimes viral, and I think that the Joshua condition show us he has a viral infection in his gut, and there. There is not.
Now, do you think we should take him to hospital, doctor? Because I think he's becoming dehydrated, and he was crying all the time, and I just think he's not well.
I completely understand your concern, but the his condition shows that completely a viral infection, and it is self-limited, and it it must likely getting better in 1 days, in 24 later times, and the only option for you, the only thing is necessary you do that to keep hydrate, Joshua, and it's very important to observing the volume of passing water urine in Joshua in the next 24 hours. And I completely understand your concern about the dehydration, or maybe you think that is better prescribing any drug, but
Oh, so do you think, doctor, he is not dehydrated now?
no, because use he, he the volume of urine or wet napkins is as usual, and breastfeeding as usual, and the appearance, he is not ill, and he at this time he is no any problem issues in terms of dehydration or etc. And his condition usually is self-limited in 2 weeks, in 24 hours later.
So what should I give him to eat, doctor?
Uh, what what you have to do is continue breastfeeding more frequently, more often when you compared with, for example, if before this disease, maybe the Joshua use 10 times per day. Now is better 10 times increase to 13 or maximum 50 times, and it's better more frequent with more volume per times. And after the diarrhea is stopped, after diarrhea will be stopped, maybe the Joshua don't desire. Well, you said that the Joshua only breastfeeding. Yes, it's okay. Only what you said, what you have to do that is continue breastfeeding.
Okay, so doctor, are you sure he's not dehydrated?
Yes, he is not dehydrated, and please continue your breastfeeding frequently.
Okay, so he is not dehydrated because I've heard dehydration is very dangerous.
No, because his condition show us he is not ill, but is the water urine, passing water urine as usual, and breastfeeding as usual, and this evidence show us Joshua is not dehydrated, and only our plan is to continue breastfeeding, but much more frequently than before.
Okay, doctor, thank you.
Okay, is there anything that I can help you today?
Anything else? No, that's it. Thank you,
Anything?
doctor.
Okay, bye. Bye.
Bye. Bye. Okay. And anything else? Yeah, anything else?
Only
there-
anything else.
Is there anything else? Yeah.
Is there anything else? Yeah.
Okay. Right. So how does that feel?
For me, as usual, as the previous, but I think that um, more hesitation, no?
No, it was okay.
Really?
Yeah. So you're happy with it? You do have some hesitation, but it's not too bad. It's much better than before. So
Yeah.
what score do you give yourself?
Not B. From 10
Yes.
out of 10.
Yes.
Um, I am a hero, and I said that 8 of 10. Is it
8.
right?
Okay.
8?
Yeah,
Really?
that's your opinion. Yes. So,
And your opinion is
well,
important.
I tell you later.
Okay.
So, what was done well and what could be done differently? Okay. So, yeah, but what was done well, do you think?
Uh, as a normal, I try to follow the structure you
Okay.
said me. Try to greeting and giving information, and after that, I'm trying to find the eyes of patient, mothers
Mm-hmm.
or fathers, and try to focus on eyes and
Okay.
set the patient, the parents that I know that show that I know that your eyes, and I'm trying to answer the eyes of patients.
Okay.
And after that, giving information based on eyes of parents. I try to do it.
Was there any queue?
Any cue is parents so worried about dehydration, and
Yep.
try to give assurance, reassurance, try yes, try to assurance about the dehydration, or maybe there is nothing to go to the hospital, or maybe giving treatment or something like that.
Okay. So the cue was yeah, dehydration, repeated
Danger.
2 or 3 times. I've heard this is dangerous. Should I go to hospital? Uh, so did you address this? Did you explain?
I try to say that reassure the parents that there is no any clue or evidence based on show us Joshua now is dehydrated because the urine, the volume of water urine is normal as usual, breastfeeding as usual, and it's I try to give advice in 24 hours is better keep breastfeeding more
Okay.
frequently and more observation about the napkins of Joshua.
Okay. Right. So basically, yes. So how about so this was information giving, yeah? Is that right? So information giving was okay. Uh, so uh, right. So how about information gathering? Do you think you gathered enough information?
I try to only ask 3 or 4 questions about the smelly blood,
Okay.
fever, and the parents added cough.
Good. Okay.
Yes, I think that yes, it was okay.
Okay. Good. So information gathering was also good. Good. So it's basically, what do you think could be done differently? I mean, you said 8 out of 10, so you lost 2 out of 10. Why? What do you think you could do
I
better?
think that need to more. I need to be more confident,
Hmm.
and this structure is encore in my mind. Now it's not automatically. I try to pressure in my mind and remember how to say,
Okay.
what to say. And I think that it's need to more repetition for this automatically I say these words or maybe the approach.
Okay. Yes, I understand that, but in terms of what you did in this situation, uh, was there anything you could do differently?
Differently. I have no idea. I have no idea.
Okay, right. So uh, you saw the patient, and the mother is worried about dehydration. Okay,
Yes.
and uh, you you said you mentioned that because Joshua has had wet nappies, it means that he is not dehydrated. Okay.
Okay.
Is there anything else you can say to see if the patient is dehydrated or not?
Um, I try to say that he is happy and there is no
Good.
evidence of ill.
Good. Illness. Okay. He's not ill. He's happy. He's playful. Okay.
Yeah.
So that's something you can say. It's a good sentence. You can say, well, Joshua is playful. Playful babies or playful children are not poorly. Okay. They're well. Um,
Okay.
so, and if I say, well, he was crying all the time at home, we say, yeah, but he's playing now, and this is good news. This is a good sign.
Okay.
Okay, he's playing. This is a good sign. It means that he's well. He's not unwell. Okay.
Okay.
Okay. And what else? How else can you say a baby is not dehydrated?
I think that the crying because when a baby is dehydrated, she is not crying.
Okay.
She is drowsy and what uh, as the same the play he is playing is shows that he is happy and not drowsy. Anything else?
Any
I think that in the
examination?
yes, in the examination, we can show the sign of dehydration in the eyes or in the skins.
Good. Okay. So yeah, that's the only thing that I would say. I would probably do differently. I would examine the patient and describe your examination or explain what you're doing. For example, and that's what I do practically. I mean, when I see patients, I say, okay, let's have a look. Let's examine Joshua. And okay, good. So I can see that uh, Joshua has got saliva in his mouth. So the mouth is humid, which is very good. It means he's not dehydrated.
Oh,
And then I check the eyes. Yes, the eyes also, there is some tear. So it means that he's not dehydrated. And then I check the skin, and the skin is not uh, dry. So when I push the skin up, when I leave it, when I let it go, it actually goes back quickly. So that's a skin turgor. And then, so that was, and yeah, and he's had wet nappies, two wet nappies, which is a good sign. It means that he has enough fluid to pass urine. Okay. So yeah, and I think about dehydration. When when you pick up a cue, you need to explore it. You addressed it, but you didn't explore it. Okay. And what do I mean by explore? The parent says dehydration three times and says, so he is not dehydrated. So I've heard dehydration is very dangerous. I've heard dehydration is uh, very serious. So you need to ask, so what do you think about dehydration, or why do you think dehydration is dangerous? How much do you know about this? Why do you think it's dangerous? Okay.
oh,
Um, okay. And then usually the patient says they've heard something, they've had an experience before, They actually, you just explore it, and then you say, look, uh, yes, in the case that you heard, it was much more serious than this, okay? Or they can say, oh, our neighbor had a child who died with dehydration. And you say, yo, well, was the baby playful, or how was the baby? Sorry to hear that. He must have been very poorly. But this is not the case here, okay? And then you explain that, look, these are the signs of dehydration. This is what you can do to check. And okay, so basically,
Okay.
uh, when you pick up a cue, you explore it, okay?
Okay.
Uh,
Sorry, Polly. Polly. How to spell it?
poorly, poorly,
Poorly. Oh yes. Yeah.
poorly, P-O-O-R-L-Y, poorly.
Okay. Okay.
Yeah.
Yeah.
And right, there was something else I wanted to say. I got mention. Oh, yeah. Safety netting. Okay. Uh, actually, it's not. You don't have to do it in this exam, but later you will have to do that. We call it safety netting. We say, well, you can always call me or come back and see me if you are worried, okay, or if you think something is not right, okay.
Okay.
So basically, you just say, for safety's sake, you plan ahead. Okay. So you can say, you can come back and see me in a couple of days. Uh, it means in 2 days' time, or maybe or earlier, if you're worried. Okay.
We can say this to all of the patients. They are worried about anything.
Uh, yes, I mean it's basically we do this as common practice for almost all children. We say to the parent, "Look, if you're worried, I can see you again in a couple of days for a review, and if you're worried at any time, you can call me earlier and you can come and see me."
Okay. I know.
Okay. Basically, safety netting means you plan ahead. You say, if this happens, I mean, if you feel something is not right, you can always come back or call back and talk to me, or go to A&E. For example, yeah, a baby comes with, I don't know, with wheeziness or something. You say, okay, the baby is okay now, but if you think he's getting worse, and if you're worried, you can go to the A&E, or if it's during the day, you call me back, and I see you on the same day as an urgent case.
Okay.
Okay, so basically, you plan ahead. You say, if this happens, what you can do, okay? And
Okay.
reassure the patient that you are available. If you're not available, what should they do? What are the warning signs? Okay, look at him. If he's crying all the time, if he's not playful, if he doesn't have any wet nappies, if his mouth is not humid, then call back, okay?
Okay.
Or come back and see me. Uh, well, you mentioned he had two vomiting. Okay, he had two vomitings. Well, you don't need to say that. You just should say, well, he was sick twice. Okay,
Oh,
he was sick
sick.
twice. Okay.
I tried to ask about the volume of
Yeah, yeah,
each vomiting.
yeah. It's well, okay, but it's not that significant. But
Okay.
okay. Now, something you did is you said in the previous consultation also, you said, can I ask you some more questions? Okay. Uh, well, obvious. That is an obvious question. So you don't actually ask a question. You just say, okay, well, let me ask you some more questions first. Okay. So you don't ask the patient, is that okay if I ask you some questions? No, we don't want that. Uh, it's
Let me.
yeah, it's a meaningless question The patient is there to answer your questions. So
Okay, I
if
know.
you say, yeah, can I ask you some more questions? Or may I ask you some more questions? Well, we say that whenever, I mean, when the patient actually is asking you questions, which is out of the context, and you say, okay, let me ask you some questions first. Is that okay? Or, or may I ask you some questions before I answer your question? You got me? So you
Yes.
basically you say, yeah, I will answer your question, but let me ask you some questions first.
Okay.
Okay. Okay. So we say basically we don't ask a question. We say let me ask you some questions. Self-limiting. We don't use that. This is a medical term. Usually we say it gets
Go
better.
away. Get
It
better.
gets better, or it goes away on its own. Okay.
Mm-hmm.
It goes away on its own, or it gets better on its own. On its own, okay?
Yes.
Uh, so it gets better on its own. On its own, okay. Right. So there was something else. You said the only thing. Yeah, well, the only thing. We don't usually say thing. The only thing. I don't remember what exactly it was. You said water,
Something like
urine.
that.
Yeah, water, urine. No, either water or urine. Okay, and you don't say both of them.
Oh, yes. I
Okay.
think that maybe the water urine is means is
No, no, no. It's water or urine. Okay.
okay.
Um. Well, what is napkin?
Napkins پوشک بچه.
No, that is
No?
nappy.
Is
That is
nappy. Oh.
nappy and nappies. Okay, napkin is what you use for. Is the kind of cloth that you use for example, at lunch table or at
Oh
dinner
yeah.
table. Okay.
Oh.
Uh,
Funny funny
okay.
mistake. Oh, thank you so much for correcting.
So that's not napkin. That's nappy.
Yeah, yeah.
Uh, so, Americans say diaper. Okay.
Okay.
In American English, but we say nappy. You said appearance. What was the? Where did you use that appearance?
General looking. Or
Oh,
maybe
yeah, yeah, yeah.
looking.
Oh, yeah. So the appearance. You said Joshua's appearance. Okay. Well, we don't use it in that sense. You said, oh, his appearance is good. Oh, no. Appearance means قیافه. Okay. It doesn't mean that his condition is good. Okay. His appearance means he looks nice. He's handsome. Okay.
Okay.
Someone's appearance is good. They're pretty.
Okay.
So we say because he's playful, he's well. So it's a good sign that he's playful. It means that he is well. It means that he's not unwell. It means that he's not poorly. Okay. So we don't use appearance in this sense. Okay.
Okay. I know.
All right. Okay. Uh, well, I'm generally I'm happy. I think yeah,
Really?
you've done well. Yes, you're doing well. Um, it's basically I think you're more structured. You still do have some hesitation. You do have grammatical mistakes, but if you continue like this, I think you can score B. Uh, uh,
It's a good sign and shows that you are an excellent teacher.
oh, thank you. That's very kind. Thank you. Okay.